My dear friends, welcome back to our senior health sessions. Today we'll sit together and talk about something that touches many of us in our golden years: high blood pressure. Some of you may feel dizzy when you stand. Some may notice headaches, while others may feel nothing at all until the doctor's cuff squeezes your arm. And the numbers surprise you. Yes, high blood pressure or hypertension is common as we age. But here is the good news. There are simple, natural methods that can bring it down gently. And that is what we'll explore today. 7 proven ways to reduce your blood pressure, shared in a way that's easy, practical, and full of wisdom. So pour yourself some tea, sit back, and let us walk through this journey together. My friends, let us start with salt. Salt makes food tasty, yes, but it also holds water inside the body. That extra fluid pushes against your blood vessels, and before you know it, your pressure climbs. I often tell my patients, taste your food before adding salt. Many times it is already seasoned enough. Use herbs like garlic, ginger, parsley, or thyme to bring flavor without burdening your heart. And be mindful of hidden salt in canned soups, breads, cereals, frozen dinners. These are quiet culprits that can trigger your blood pressure. I remember a patient, Mary, who loved canned soup. Once she switched to homemade vegetable soup with fresh herbs, her blood pressure reading came down. And she smiled, saying, "Doctor, I didn't miss the salt, I gained flavor." So remember, wisdom is not in giving up taste, but in seasoning with health. Now let us talk about movement. When I say exercise, I don't mean marathons or gyms. I mean gentle, steady movement that keeps your heart strong. A strong heart pumps blood with less effort, and that means lower diastolic pressure. You can just take a walk after meals. Try chair exercises if your knees aches you. Stretch or practice gentle yoga or tai chi. I know a gentleman, Mr. Johnson, in his late 70s. He started with 5 minutes of walking a day. A year later, he walks 30 minutes daily. His heart became stronger, and his doctor even reduced one of his medications. Remember, the body is like a clock. If it keeps moving, it keeps ticking smoothly. My dear friends, food is more than comfort. Food is medicine. Every bite we take either helps our blood pressure or makes it climb. So let's talk about foods that raise our blood pressure and foods that bring it down. Some foods that raises our blood pressure are processed meats like bacon, sausage, and deli ham, full of hidden salt. Canned soups and frozen dinners, quick to make but heavy with sodium. And fried foods, they harden arteries over time. Salty snacks like chips, pretzels, and salted nuts. Sugary drinks like sodas, sweet tea. Energy drinks also increases one's diastolic blood pressure. These should be occasional foods to include in your meal. Let's take a close look at foods that lower blood pressure. They are called the healing foods, and they are bananas, which is rich in potassium, sweeping away excess sodium in your body system. Oranges and citrus fruits are refreshing and heart protective. Leafy greens, spinach, kale, collards, they relaxes your vessels. Berries are antioxidants that keep arteries flexible. Beets and beet juice are rich in nitrates, opening your blood vessels. Sweet potatoes are comforting food that is rich in potassium. Beans and lentils is also good for pressure and cholesterol. Fatty fish, salmon, mackerel, tuna are rich in omega-3. Oats is steady breakfast food that supports the heart and makes it function well. Do not think of it as giving up your favorite foods. Think of it as inviting new friends to your table. You can swap fried chips for an apple. Replace ham with turkey. Enjoy oatmeal with berries instead of sugary cereal. As I tell my patients, your kitchen is your pharmacy. Your plate can be your prescription. My friends, let us speak plainly. Too much alcohol pushes one's blood pressure upward. If you enjoy a drink, keep it small, keep it rare. A glass of wine now and then is fine, but moderation is best. And smoking. Smoking harms the blood vessels. It makes the heart strain and shortens the breath of life. It is never too late to quit. Seniors who stop smoking sees benefits within weeks. Changes like clearer lungs, steadier pressure, more energy. I often tell patients, if you put down the cigarette today, your heart will thank you tomorrow. Stress is also an hidden enemy of blood pressure. When we are anxious, The body releases hormones that tighten the blood vessels, raising your blood pressure reading high. So how do we fight stress? Not with more worry, but with calm, but with deep breathing, slow in, gentle out. Also with prayer or meditation, having quiet time with God or your thoughts. Listening to soft music, old hymns, gentle jazz, songs that soothes you. Talking with a friend also helps to share and lightens the heaviness of the heart. I often tell my seniors, do not carry the world on your shoulders. Lay it down, for your heart cannot bear it alone. Another method to reduce blood pressure is to sleep well. Sleep is not just rest, it is medicinal for the heart. At night, when you sleep well, your blood pressure naturally lowers. But many seniors struggle with poor sleep. Here are some gentle tips to help you sleep well. Keep a steady sleep routine. Sleep and wake up the same time each day. Make your room calm, dark and cool. Avoid caffeine or heavy meals eaten late in the evening. Try light stretching or warm milk before bed. Listening to sleep hypnosis or bedtime story audio and video. A good night's sleep is one of the cheapest but most powerful treatments for high blood pressure. Friends, let me walk you through how to track your blood pressure. You cannot manage what you do not measure. Have a home blood pressure monitor. Check once or twice a week, around the same time. Write down the blood pressure reading in a notebook. When you visit your doctor, you will have a clear picture of blood pressure reading. So let us recap the 7 natural methods, my dear friends. Watch your salt. Stay active. Eat smarter. Foods that heal. Not increase your blood pressure and also harm your heart. Limit alcohol. Quit smoking. Manage stress with calm practices. Get enough sleep. Keep track of your blood pressure reading. As seniors, you can track your blood pressure at home. I recommend using an upper arm monitor because it's more accurate than wrist devices. Reliable brands like Omron Platinum or Omron 5 series have large displays, one-touch operation, and memory storage for easy use. Always check that the cuff fits your arm comfortably and take your readings at the same time each day. You do not need to do everything at once to control your blood pressure. Start small. One step today, another tomorrow. With time, these small steps become a path to a healthy heart. Now, before we go, let me ask you, did any of these 7 methods surprise you? Or is there one you are already practicing? I'd love to hear your wisdom and stories in the comments. And if this video has helped you, please like it so that other seniors can find it and join our community. And don't forget to subscribe so you'll never miss our future conversations about health, life and wisdom in our golden years. Until next time, my dear friends, care for your heart, care for your body, and care for your peace of mind. Stay blessed and stay well.